Let's read this. Treasure FCPS2 October 2021. Multiple hypervascular liver mets arise most commonly from carcinoid. Number 2. Angina or sound periods bilateral epidemic kidneys with small cyst. Oligohydramnios and pulmonary hyperplasia trigger some recessive polycystic kidney disease. 3. Fundal sinusitis with peripheral enhancing extracorneal collection, puppy tumor. Fundal extracranial collection, puppy tumor. 4. Low T1 T2 swelling or dorsum aspirating fingers moving with tendons, gland structure or tendon sheet. 5. Large echogenic mass in right lobe of liver in a child hepatoblastoma. 6. Large lesion with peripheral arterial PCE becomes indent or delayed diagnosis hemangioma. 8. Mm, history of arthritis involving second plus third metacarpal, low sclera, increased liver density, diagnosis hemochromatosis. 8. History of RTA, blood loss, non-enhancing renal cortex, acute cortical necrosis. 9. History of damaged bladder, post-contrast study, oliguria which resolves after 1 to 2 days, acute tubular necrosis. 10. History of breast cancer and radiation, most common cell type decreases, lymphocytes. 11. History of renal intervention, early IVC enhancement in arterial phase, arteriovenous malformation, AV fistula. 12. Child with fever, stridor, thickened epiglottis and epiglottic fold or lateral epiglottitis. 13. Female parent with cough on HRCT, multiple tiny nodules in subpleural and peribronchvascular located sarcoidosis. 14. Young girl with non-primatization of paranasal sinuses with thinning of outer table of skull, diagnosed thalassemia. 15. 35-year-old male with anemia, thrombocytopenia, reticulonodular infiltrates in the lung, left lobe, and then decreased T1 plus T2 on bone marrow. Whose diagnosis is X-ray finding is Erlenmeyer Frost deformity, diagnosed as Gaucher syndrome. 16. Nerve injury associated with acetabular fracture, posterior rim fracture. 17. Small subarachnoid hemorrhage, hyperintense sulci and cisterns at T2 flare. 18. Image of cardiac MRI is premembranous VSD. 19. Image of CT chest is right atrial thrombus. 20. Image of chest PDA is associated with maternal rubella. Next, Raymond image of TMSA, age of recurrent UTI, right upper lobe cortical scarring. 22. Carotid Doppler, ICA PHP 135, ICA by CCA ratio 2.5, ADV 50 to 69%, ICA stenosis. 23. Hip ultrasound trial for DDH, alpha angle 45 degrees, beta angle 77 degrees, storage type 2C, dislocation. 24. Patient with bilateral symmetrical hyalinopathy, hepatomegaly, and multiple hypodense splenic nodules, diagnosed sarcoidosis. 25. History of hepatitis B, lesion liver with washout, hepatocellular carcinoma. 26. Scenario of Whipple disease, sands and nodules, non-drained bowel. 27. History of malignancy in distal esophageal stricture, most common is squamous carcinoma. 28. Well-defined smooth hypodense mass in jejunum with history of anemia and melanoma. Next, carcinoma ovary with uterine involvement, stage 2A. Carcinoma bladder, haziness and prevesical fat, stage 3B. Carcinoma posterior with high semivesicle involved, stage 3C. Right semivesicle involved, stage 3C. History of RCC, involvement of renal vein in first and subdiaphragmatic IPC atrium, T3C. History of epistosis, true about plexus, involves parietal pleura. Ultrasound orbits uh, showing economic foci in vitreous with artifacts, asteroid Helen 45 for child history of fever, cough, lung hyperventilated, peribronchial coughing, and small pleural effusion like the rhinovirus. Then preterm infant with uh, reticulogranular lung infiltrates and distress in RDS, respiratory syndrome, child with widening of size and elongation of femur uh, node is SCFP, slip of capital upper femur emphysal. On mammo, linear branching, microcalcification without obvious masses, structural situ. Scenario of unilateral nipple discharge, mammography, a few mammo, few nodules, wash normal, next appropriate energy is doctography, it is unilateral nipple discharge. Then post-term CT, child with patchy lung emphysagation and no airborne gum that goes in respiration. Adult patient with intramedullary expansion lesion causing urine apparatus and lamina, ependymoma. A female with bilateral enlarged extraocular muscles with sparing of tendon, thyroid ophthalmopathy, extra-articular fracture distal radius with volar angulation, Smith fracture, male breast, hypochoric retroarterial mass, eccentric, the nipple, diagnosed intradermal carcinoma, intravaginal mass with connecting stalk and feeding vessel, polyp vaginal, cyst anterolateral to upper one-third vagina, Gardner 6, hockey stick sign on MRI, variant CJD, could be Jacob disease, female postpartum status, headache, ALOC, vomiting, uh, T2 high signal in bilateral occipital lobes, plus D2I, press syndrome, history of hypertension, headache in male adult, T2 slash clear, in both occipital lobes in white and subcortical white matter, diagonal press, VSD with dilated central pulmonary arteries with peripheral pruning, and Meggers syndrome, history of nephrectomy, since nephrectomy, the parent has RCC now with brain lesion, crossing midline with peripheral enhancement, edema, increased then brain size, metastasis. Even brain, this is most likely occurring sarcoma. Fine. History of ptosis, meiosis, pulsatile tetanus, previous history of TIA, curve dissection, Horner syndrome, uh, neonate tuberculosis associated with Cowden syndrome, my brain tumor heterogeneous attached to circumpaludism with enlarged frontal horn, diagnosed central neurosarcoma, history of epilepsy, cortical-based bubbly cystic lesion with no PCE, post-contrast enhancement or edema, TNET. Another was probably for BPD, beauty or something, tumor with red. Most sensitive investigation for environment disease is MRI FDG PET. I think it's HMPA. Oh, okay. The history of fever, sore throat, increased ulcer, anemia, enlarged left atrial appendage and left atrial medullary stenosis. Infant with history of cyanosis, plethora, CM and narrow pedicel, transfer of great vessels. X-ray orbital fracture, uh, orbital blowout fracture. Other options were left out in Travers, so blowout fracture. And then question number 8 again. Cyst with unerupted tooth is dentary cyst. History of RTS, seed bed injury, breast lesion with axial calcification, oil cyst. History of RTA, horizontal fracture through vertebra, parietal bone, and lamina, chance fracture. History of all occurs, nodular thickening of stomach without any obvious mass, lymphadenopathy, Crohn's disease, Crohn's lymphoma, I think Crohn's due occurs, but all occurs and not thickening of stomach, I think Crohn's, Muslim Crohn's. Next one is 50. History of female hospitalized and admitted interception, electrolyte uh, disturb, disturbed, and ALOC, ASI shows uh, ASI in central pons showing restricted diffusion. Okay, present central pons melanosis. Next question. Bushwanger disease scenario, pain of subcortical U fibers. Then history of bilateral cystic renal disease, holoprosencephaly, occipital encephalocele, polydactyly, Becker-Gerber syndrome. Most common demyelinating disease in spine is multiple sclerosis. For chronic infection, gallium scintigraphy is 100% sensitive. Image of gallium scan showing increased uptake bilateral lower thoracic plus upper abdominal region. History of treated lymphoma patient options are okay. I think D was correct. Infection was composite sarcoma.